Hey, this is Dr. Padda, and I wanted to talk a little bit about muscle mass and why it's important for our pain patients. I think that it's frequently overlooked and people don't understand it. So muscle mass is really the organ of longevity. When you lose your muscle mass, it increases the likelihood of falls, it increases your frailty. It's called sarcopenic wasting. What you'll notice is that you lose the muscle mass in your legs, you lose the muscle mass in your arms, and that prevents you from movement. And you need that muscle mass to essentially take up a lot of the glucose that circulates in your blood. You need that muscle mass to allow you to move more effectively. You need that muscle mass to be more functional. And when you lose it, you end up becoming sarcopenically wasted. If you become sarcopenically wasted, it increases your frailty levels and it increases dramatically your risk of fall. And if you fall, for example, somebody who falls and they have a hip fracture, they have about a 50% chance of getting a blood clot in the next couple of weeks. And if they have to have hip surgery, that could really dramatically increase the risk of death. And so what we want to do is make sure that we minimize sarcopenic wasting in our patients. And that means that we have to make sure that they're having the appropriate dietary intake, but also that they're actually moving those muscles. What happens, just as a refresher, is that when we consume carbohydrates, when we take in sugars, our body releases insulin. And when it releases insulin, the blood sugar is taken out of the blood, and initially it's stored as glycogen in our liver. But if our glycogen in our liver is full because we didn't use it, because we're not moving our muscle, we're not doing activities, then it overflows and it becomes fat. And as it becomes fat, it gets stored and it marbleizes into the muscle. So when you look at patients that have sarcopenic wasting, which is loss of muscle, and then you see the marbling effect, then you know that they've intercalated a bunch of fat into their muscle, and you know that they're on the slippery slope of becoming type 2 diabetic. The key element is to understand that and to do whatever it is that we can do to improve our insulin sensitivity and improve our muscle mass. The other thing is that sometimes weight alone doesn't tell us much, and the appearance of somebody doesn't tell us much. So it's called being skinny fat. Let's say that your weight looks okay, but you've lost all of your muscle mass. Well, that's a problem, because you may have lost your muscle mass and you're not able to buffer and you're not able to move, and you've got a fatty liver, and that's a major issue, and your inflammatory status is really poor. Just because you're thin doesn't get you out of the woods here. And the other thing is that you might have a high mass, you might have a high BMI, but you have a lot of muscle, and that is actually probably a good thing. And so the weight alone is not the issue. It's the issue of muscle mass compared to fat mass. And really what you're looking for is the ability of the body to recover from an injury, the ability of the body to recover even from exercise. Our main goal is to reduce metabolic inflammation, which thereby reduces heart attack risk, it reduces cardiovascular risk, and reduces blood clots, and reduces stroke risk, and reduces the risk of death. So one of the things that I talk to with my patients is the use of sauna. Sauna is a way that they can increase their metabolism, increase their use of glucose, and it simulates exercise without actually having to exercise. So I have patients that have tremendous difficulty on a day-to-day basis, and they can't get up or down the steps. And in the initial portion and in the initial treatment of what we need to do, we'll have them use a sauna, and we'll have them do it to their heat tolerance. And it's been shown that the sauna independently mimics exercise, and that's really important. The other thing that we do sometimes in patients that have had a significant injury and they can't really move, we use something called blood flow restriction bands. And what that does is it restricts the amount of total blood that goes into that arm so that it reduces, or into that leg, and so they can do minimal activity with that, and it creates the artificial concept that that thing is being exercised, and it helps maintain muscle mass even in the presence of injury. A lot of these studies were done in Japan, and it shows some effectiveness. So if you want additional information, obviously we can chat in person when you're in our clinic, but if you click the link below, there's information on how to improve muscle mass as it relates to pain management. If you have any other questions, please feel free to reach out to me. You can always shoot us a text message or send us an email or ask the question below. Certainly download that checklist, though. I think it'll help. Thanks.